Hello, so today we're going to be talking about healthy work environments and how it pertains to nurse leadership. So just the purpose of today, we're going to illustrate the significance of establishing a healthy workplace environment in nursing. So we're also going to outline the role of the nurse leaders in achieving such. Our agenda, we want to outline the definition and significance of the topic. We want to talk about what affects the work environment and projected solutions. So we have three main projected solutions, including a conceptual model and the RNAO best practice guidelines and some 5-factor model to communication. I also want to discuss the relevancy to nurse leaders and what implications this holds for future practice. So just a definition of a healthy workplace environment. So it is a practice setting that maintains the health and well-being of nurses. So quality patient client outcomes and organizational performance, as well as societal outcomes. So what does it look like? So there's a presence of authentic leadership within a healthy workplace environment. So this includes nurse managers. There's perceived adequacy of staffing. So this includes staff to patient ratios as well as staff assignments. There is a culture of accountability and communication. So communication is one of the key determinants of a healthy workplace environment. So having that positive communication is vital. Control over one's own nursing practice. Shared decision making at all levels, so this is true collaboration. Recognition of the value of nurses' contributions. And finally, encouragement of professional practice and continued growth and development. So why is it important? Why is a healthy workplace important? So it actually improves patient outcomes, so this is through the quality and flow of care. There's a reduction in medical errors and or ineffective delivery of care to occur. It contributes to the overall health of nurses and aids in recruitment and retention of nurses. So if those nurses are happy in their work environment, they'll want to stay there and they'll want to work and they'll want to reference it to other people and recommend it. It also yields financial benefits to organizations. So there's less of a turnover of nurses, which causes a reduction in costs of charging staff to train new staff, as well as for the exit interviews and exiting process of leaving staff. There's also finally an increased trust between management and employees. So contributing factors to unhealthy work environment would be internal issues such as poor management, policies, and structure of workplace. Staff shortages, so that is believed to be directly related to unhealthy work environment, as well as budgeting, but staff shortages, they cause caregiver burnout, so these nurses become loaded and tired and overworked, so that will contribute to an unhealthy work environment. There's also communication inadequacy, so like I said, communication is key, and with poor communication, with poor communication, there might have to be reiterated phone calls or conversations, and then that just aids to some frustration all around. And finally, a lack of support networks. So projected solutions to dealing with unhealthy work environments and resolving them. First of all, there's the conceptual framework for healthy work environments for nurses. It's developed by the RNAO. So it looks at 3 different levels. There's the physical, so that's more of the individual level. There's the organizational level and the external level. So they look at each within 3 different groupings of components. So there's the physical and structural policy components, professional occupational components, and cognitive, psycho-social, and cultural components. So an example of the physical and structural policy components, so at the individual level would be workload, changing schedules, or heavy lifting. So then at the organizational level, they're more looking at staffing practices, access to functional lifting equipment, and occupational health and safety practices. And then at the external level, so there is healthcare delivery models, fundings, economic and political frameworks. So that's for the physical, and then there's others within the professional and occupational and the cognitive and psychosocial component. So this is just a big figure image for you to see those components and those factor levels. So based on that model, the RNAO developed 6 best practice guidelines, so incorporating all of those components and identifying what needs to be addressed in order to overcome such. So the 6 best practice guidelines to achieving a healthy work environment include collaborative practice among nurse teams, developing and sustaining effective staffing and workload practices, developing and sustaining nursing leadership, embracing cultural diversity in healthcare, so that means developing cultural competency, and professionalism in nursing, and workplace health, safety, and well-being of the nurse. So Parsets' theory of human becoming, so this is just another model to aid in that achievement of a positive work environment. So because communication is so influential on determining the health work environment, so this is a communication theory. They believe that when you incorporate all 5 factors and use them together simultaneously, that good communication will be achieved. So an example of the self-deception, the first one would be acknowledging a misconception. The second one factor is self-reflection. So that means pondering about previous experiences and learning from it. The third is becoming authentic, so holding and practicing professional values. The fourth factor is becoming mindful, so developing heightened awareness to verbal and nonverbal communication between patients and your peers, so your coworkers. The final factor is becoming candid, so that includes speaking purposefully and free of bias. So nurse leaders' role in the healthy work environment. So what can a nurse leader do to help this? So just a definition of a nurse leadership. So it focuses on critical thinking, action, and advocacy, and it happens in all roles and domains of nursing practice. So these nurse leaders, they are so influential in determining the healthy work environment. They're key components, and they create and support and sustain those environments. So there's 2 main types of nurse leaders in the workplace. So there's the people and relationship orientated leadership style. So those type of leaders are transformational, resonant, supportive, and considerate. While there's also the task completion leadership style. So those leaders are more dissonant, instrumental, and management by exception. So research finds that the people and relationship orientated leaders tend to generate more positive and healthy workplace environments as opposed to the task completion leaders. I firsthand have seen the difference between the two with our clerk nurses. The one is more people and relationship orientated, so she is very approachable and accommodating. She's willing to make changes in her day to accommodate others, as like in terms of patients and nurses, not just the nurses. And whereas the other one, she more is a task completion leadership, so she becomes very irritable if she doesn't achieve her task or accomplish what she has planned for the day, and that generates a negative atmosphere at the nursing station and just an overall day. It definitely sets the tone, so I have seen that firsthand. So what else can nurse leaders do to sustain a healthy environment? They can become advocates and role models for guidelines, so they can practice those best practice guidelines I went over and just facilitate them daily. They can guide the clinical team by encouraging professional development, providing continual education, and promoting clinical experience. They can encourage and facilitate skilled communication, so also lead by example. They can be examples for those novice nurses on how to communicate efficiently. They can engage staff in development of shared values in their work at a unit level. So implications for future practice, I myself am definitely going to continue developing that efficient communication skills. Communication is everything, especially in contributing to healthy work environments, but not just that, and lots of things. So I just want to keep working on that. I advocate for self, coworkers, and patients, so speak up when I feel something is unjust or know that there's room for change. Utilize resources and conceptual models contributing to development of healthy workplace environments. So like the RNAO or the CNA, we have lots of resources that we can use and look at models and best practice guidelines to just apply to practice. And finally, I'll continue to observe nurse leaders and learn by example. So just in summary, healthy workplace environments generate enhanced patient outcomes, nurses' overall health, and organizational structures. There's 3 determinant level factors of the conceptual model for healthy work environments, including individual, organizational, and external. And there's 6 best practice guidelines developed by the RNAO for practitioners in Ontario. And nurse leaders are key determinants of vibrant professional work environments. So therefore, attaining a healthy work environment is pertinent to enhancing patient outcomes and nurse satisfaction. Without such, medical errors, ineffective delivery of care, and conflict among healthcare providers is likely to occur. Thank you.